Why do you wake up every night around 2 or 3 in the morning? You may already sense that something isn't right, but frequent nighttime awakenings are not always just a normal part of getting older. Very often, they are a sign that your body's internal balance is being disturbed. Many people experience the same pattern. As morning approaches, their eyes open for no clear reason. There is no pain, no noise, no urgent need to use the bathroom, and yet the body wakes up clearly and suddenly, as if an invisible alarm has been triggered from within. Medical tests often show nothing wrong. The heart looks normal. The kidneys are fine. There is no inflammation, no tumor, no blockage. And still, sleep breaks apart night after night. If this is dismissed as just aging, an important message from the body may be overlooked. Repeated nighttime awakenings are commonly blamed on urine volume, but in many cases they are actually tied to quiet, deeper imbalances inside the body. When these imbalances persist, they do more than disrupt sleep. They slowly and subtly wear down overall health. Over decades of clinical practice, I have met countless patients who say the same thing. "Doctor, I'm not sick, but I wake up 3 or 4 times every night. Am I aging faster than everyone else? Are my kidneys getting weaker?" What confuses them most is that nearly all test results come back normal. Kidneys are healthy, bladders are intact, prostate size is acceptable, urine tests are clean. Yet restful sleep never returns. One patient, a careful man in his mid-50s, barely drank water in the evening because he was afraid of waking up at night. He even endured thirst, and he ate extremely bland meals for the sake of his heart. Ironically, he woke up at least 3 times every night and felt exhausted and heavy every morning. Closer examination revealed poor peripheral circulation and a mild, chronic inflammatory state. Nothing dramatic, but enough to destabilize the body's fine regulatory systems. Another elderly woman was convinced her kidneys were failing, yet her kidney function was excellent for her age. The only notable issues were minimal daily water intake and mild leg swelling in the afternoon. She believed drinking less water would reduce nighttime urination, not realizing that long-term water and salt deficiency can actually push the body to increase nighttime excretion instead. The common thread in these cases is not how much urine is in the bladder, but how sensitive the nervous system controlling it has become. During the day, the same amount of urine causes no discomfort. At night, however, heart rate slows, circulation decreases, and imbalances that build up throughout the day become more apparent. Even small changes inside the body can now trigger awakening signals. The body never wakes us without a reason. Repeated sleep disruption is often the body's attempt to correct instability. When people focus only on suppressing symptoms, by drinking less water or eating even more bland food, they often worsen the underlying imbalance instead of fixing it. Many patients who wake up at the same time every night believe enduring thirst will help them sleep more deeply, but the opposite is usually true. When evening fluid intake is too low, blood becomes more concentrated. The body does not consider this safe. To protect vital organs, the kidneys increase excretion to correct osmotic imbalance, which paradoxically leads to more nighttime awakenings. Long-term low-sodium intake plays a role as well. Sodium is not just about blood pressure. It helps keep water inside blood vessels. When sodium levels remain too low, fluid shifts into tissues during the day and returns to the bloodstream at night, forcing the kidneys to process large volumes in a short time. This again triggers awakening signals. Another overlooked factor is low-grade chronic inflammation and reduced microcirculation. This type of inflammation causes no pain, fever, or obvious daytime fatigue, but it stiffens small blood vessels and disrupts blood flow to delicate nerve fibers that regulate bladder function. During the day, movement and stronger circulation mask the problem. At night, when everything slows down, these weaknesses become obvious. The nervous system, especially the autonomic nervous system, becomes overly alert, reacting strongly to even minor changes in fluid or mineral balance. Many people blame themselves, thinking they are simply aging or overly sensitive, but nighttime-only symptoms usually mean the body can no longer compensate for the day's accumulated imbalance. Nighttime awakenings should not be viewed as an enemy. They are not punishments or failures. They are messages. Suppressing them without addressing the root cause is like silencing a smoke alarm without putting out the fire. The real solution lies in restoring internal stability. Proper hydration and mineral balance are not about excess, but about adequacy. For many people, gently supporting the body works better than strict restriction. Warm water in the evening helps more than hydration alone. It gently expands small blood vessels, improves circulation, and signals the nervous system to relax. When a very small pinch of salt is added, not enough to taste, it helps keep fluid where it belongs inside the blood vessels and prevents sudden osmotic shifts that overstimulate the nervous system. A thin slice of lemon can further support microcirculation, provide mild antioxidants, and help balance sodium with natural potassium. Patients who adopt this gentle approach often notice changes quickly. The first improvement is not always fewer awakenings, but lighter mornings, warmer hands and feet, and a sense that the body actually rested. Over time, nighttime awakenings gradually decrease, sometimes disappearing altogether. These changes are not miracles or medications. They simply allow the body to return to the balance it has always been trying to achieve. When blood is no longer overly concentrated, circulation improves, and the nervous system no longer has to stay on high alert, sleep naturally deepens. Timing and consistency matter. Drinking warm water with a tiny pinch of salt and a slice of lemon about an hour before bed gives the body time to distribute fluids properly. The water should feel comfortably warm, not hot or cold. Most importantly, this should be done gently, paying attention to how the body responds, without force or fear. Sleep is not just rest. It is a mirror of internal balance. When the body is understood and treated with patience, it responds with quieter nights and lighter mornings. Instead of seeing nighttime awakenings as an enemy, they can be understood as a signal to care for the body more wisely.